Ladies and gentlemen, come to order if you will. We are calling the Regulated Industries Committee meeting to order. Chairman Powell had a conflicting meeting, and so as his vice chair, I'll be chairing the meeting today. We have two bills to consider. The first one is House Bill 430, which is sponsored by Chairman Powell. And this bill is a simple bill. It allows for licensure of advanced practice registered nurses in the state, and it also gives them some authority to issue handicapped permits. I'm going to ask Ms. Juliana McConnell to explain this bill in a little more detail on behalf of Chairman Powell.
The 2021 legislative session, authored by Chairman Alan Powell. This committee is actually, the bill was brought before you last year and was briefly discussed at that time. However, it did need to go to the for GORC review. So we did take the bill to GORC, and back in July, it was approved. They did, with the version that was approved though, they did ask that we remove one small section of the bill, and that had to do with workforce data collection. So that portion of the bill has been removed. So the version that's before you today for consideration and approval, it actually does two things. The first part, the major part, is it authorizes an APRN license in the state for our APRNs. It does not change any requirements to become an APRN. Currently, you must become an RN first, and then once you meet the requirements, the education and the training and testing requirements, then you become an APRN. But we're one of only 10 states that when they do meet those requirements, right now they get just what's called an authorization to practice as an APRN. It's similar to, like, they get a piece of paper and it is approved through the Board of Nursing, but this would create an APRN license. So once they make those requirements, now they would be issued a license. So as I said, it doesn't change the process, and even the process of the way they go through completing the information with the Secretary of State. It's just at the end of that time, they will receive an APRN licensure. And the second part of that is just to authorize APRNs and PAs. It gives them the ability to write orders for disability permits, parking permits. That's under the Department of Revenue. It was discussed last year with the Department of Revenue, and they had no problems. And it merely adds them, there's a list of authorized healthcare providers that can authorize a parking permit. And right now, APRNs and PAs are not on that list. And this would merely just add them to the list of healthcare providers that could write those parking permits. So that's the two major parts of that bill. And like I said, it went through the GORC process and back in June, and was approved in July with the removal of the workforce data collection. I know in the committee there was some concern about adding that, and also when it went to GORC, they asked that that be removed from the bill. So that's the reason you see the substitute bill before you today. And now, and let me explain too, originally when the bill was also originally introduced, it also had home health care authorization. And that seemed, at the time, we were receiving a great deal of concern expressed to us from others about having that in there. So at that time, we decided just to remove that. And it was actually removed from the version that even before it went to GORC. And that's something we would like to see happen, and have probably even at in another legislation, or either this session or next. But right now, this bill, it does not include that.
Thank you, Ms. McConnell. Please just stay there for a moment.
Okay.
We want to have any discussion or questions of the committee. Number 25 is who? Chairman Williamson.
Thank you, Mr. Chairman. Just a quick question about the licensing of the APRNs. You mentioned that prior to this licensing requirement, they're basically given permission, a permit, or
It's called an authorization to practice.
is
So
that
it's-
a temporary authorization? or
No,
is it
no, it's a
permanent?
permanent authorization.
So this is really just a nomenclature.
Right,
change,
exactly.
just-
Instead of giving them a piece of paper that says they have an authorization to practice, now they'll be given a formal license with a number where it can also be more easily tracked, the APRs, and which also helps in the safety side of it.
Makes sense. Just a follow-up question. Are there
Yes.
any fees involved with either one of the
Yeah,
currently? or-
they currently have to pay a fee when they get an RN license. And so currently, if you get an RN license, like some of these ladies on the front are RNs, but then they get an RN license and they pay a fee. Then at the same time, they must complete and get an APRN authorization to practice, and they pay a fee. But they'll still be paying that fee, but now it would go for an APRN license. And
So
there's
there's no
nothing in the
change
bill
in
to
the
increase.
fees?
No, there's no recommendation for changing the fees
Thank you.
unless,
That's all the questions I have.
okay.
Okay, members of the committee, is any other discussion or any questions for Ms. McConnell before she steps down? Anyone? Okay, thank you very much. We have two members of the audience that want to comment on the bill. Mr. I'm sorry. Oh, that's fulfilled. I'm sorry. Okay. I'm sorry. I thought they were, yeah, check that. And on 412. Okay, if there are no questions, what is the pleasure of the committee?
Move to pass. Second.
We have a motion and a second for a do pass recommendation. Is any other discussion on it? All those in favor say aye.
Aye.
Opposed, no. And it passes. Next, we have House Bill 412. And we have Chairman Katie Dempsey to come and present this bill.
Good afternoon, Mr. Chairman, and members of the committee. If you are ready, and I have brought with me, he testified when we first heard this bill, but Dr. Muthing is here with me as well for some very specific information for what we're going to discuss today. But thank you. This is a return to revisit HB 412 for the licensure of individuals in the practice of applied behavioral analysis. I don't think there's anyone here that would doubt for 1 minute how much the need is. We're hearing more and more about it as we discuss mental health right now, particularly. This is a wonderful tool to use with children, adults, people of all ages dealing with autism, with geriatric challenges, traumatic brain injury, developmental disabilities, substance abuse, and behavior disorders. Right now, there are no legal protections for Georgia patients against those who might claim to practice ABA professionally, or to ensure that those who do meet established standards for education, practical training, and demonstrated knowledge of behavioral analysis. It is a very, very distinct profession with specific requirements, distinct training and competencies, and we need to ensure that when someone says they are certified, that they actually are also licensed within our state to provide those services. Additionally, no entity in our state exists to provide oversight of ABA practitioners or investigate allegations of wrongdoing. Therefore, consumers, employers, funders, and state agencies have no protection right now from individuals who make false claims to be qualified to practice ABA. The bill is really quite straightforward. I believe that in your folder, you also have the information from GORC. I had never been through that process before, and I truly appreciate the Georgia Occupational Regulation Review Council and what they do. It was quite interesting. I learned a lot. We worked over the summer, and their recommendation in there was for it to move through the committee to also have the support and passage of this to ensure consumer protection, actually, for our state, some of our most vulnerable populations, people who are often much more susceptible to abuse. So the bill is there. I know we've heard it before. It is a practice in 33 other states. So we are a little behind the curve. It's time for Georgia to step up and do that as well. And also with Medicaid dollars right now, the need for protection as providers move into Georgia to deliver these services are very, very necessary. Would it be okay if Dr. Muthing speaks specifically to what it will direct? And then I'm also available, and I know there are others who wish to speak too.
Yes, ma'am.
Great, great.
Thank you, Chairwoman Dempsey, and thank you, committee members, for allowing me to speak. I'm Colin Muthing. I'm here on behalf of the Georgia Association for Behavior Analysis. I'm a past president of that association, and I'm currently the chair and have been the chair of the licensure committee for the past 4 years. This bill boils down to ensuring that vulnerable Georgians receive the proper care and appropriate consumer protection. That's the bottom line of this. It's about a safety, ensuring all those that claim to practice applied behavior analysis meet the nationally established standards for training, education, and knowledge. There is no state agency currently that can provide that protection for individuals making false claims to practice applied behavior analysis. There is a National Behavior Analysis Certification Board, and they have some oversight for those who hold a certificate, but they cannot do anything about anyone who is in the state purporting to practice applied behavior analysis, but does not have a current certificate. As Chairwoman Dempsey mentioned, this profession is rapidly becoming regulated across the country, as 33 states already have a current licensure board for behavior analysts. And again, this bill would provide that protection for consumers, employers, funders, and the profession as the influx of individuals coming into the state based on the recent Medicaid approval for these services has increased the number of behavior analysts that are coming into the state pretty significantly over the past 3 years. I don't want to repeat anything that Chairwoman Dempsey so eloquently said. Are there any questions or anything that I can answer while I'm up here?
Okay, members of the committee, time for questions, number 2021.
Thank you, Chairman. So walk me through this process of exactly how that process works, not on the licensing piece, but to visit an analyst, if you will. I just need to kind of get a feel for it.
Sure. Right now, what I think would typically occur is that you get like a referral from a pediatrician or a doctor for, seeing a behavior analyst. You would then contact, a local community provider or a state provider, as there are state providers, and gain services that way. As Chairwoman Dempsey pointed out, the majority of the individuals served have some sort of developmental disability or disability, traumatic brain injury, geriatric populations. Autism is a large one. And so you would just need that referral, and then you would be able to access services once either private insurance approves it or Medicaid authorizes those services.
I got you. So you're saying because Medicaid has come in and said that they're going to start paying for this, it's bringing a lot of bad actors into town.
A lot of people are moving in to open up shop. Yep.
Okay. But they still have to have that referral from a professional.
It doesn't require that. That's typically how it happens, though. You see your pediatrician, they notice something developmentally might be askew, and they refer you and say, go find someone to kind of look into this or provide those services. You could always call up a BCBA or board certified behavior analyst and their shop and kind of get services that way.
I got you. So there's an internal fear that the doctors are going to send their patients to a bad actor.
Correct.
Okay.
Okay, Representative Walensky.
Thank you, Chair. After reading this bill and hearing y'all's comments, so really what this is doing is creating a board that's just a good protection on behavior analysis who go into people's homes. And we just want to make sure those are safe people. And this is a great start. We can do more in the future, but we need to start somewhere.
Yeah, Yeah, this is the start to providing that protection for that vulnerable population of individuals receiving those services.
And you would agree you have the best state rep at this Capitol, true?
Yes.
Okay.
I didn't know he's my voter, but I'm sure glad to see you, sir.
If you don't know he's your voter, you probably ain't his representative. No more questions.
Secretary Williams.
Yes, thank you for the presentation. And sort of the same vein as previous two state reps. Looking at this as a protecting patients in Georgia, the a question comes to mind. You mentioned it'd be covered by Medicaid. Now this service is provided by Medicaid. What about private insurance?
Yes.
Is that currently the
covered.
case?
Mhm.
This self-regulating board, does the conditions so there's national standards in place for the self-regulating board to adopt? Is that what I understand you to say?
That there is a state like credentialing board, the behavior analysis credentialing board that is set up, and they can provide oversight for current certificates, but nobody else.
But that board's going to adopt national standards. as
Correct.
approved.
Yes.
Okay.
Yes.
And a follow-up question on that then, is it commonplace for your profession to carry malpractice insurance?
Yes.
Is that going to be a requirement? Is that a national?
It is not listed in the bill at this time.
Well, but your board's going to write your own self-governing rules,
Correct.
correct? Is that commonplace in other states for the board to adopt a mandatory professional liability insurance?
I don't have an accurate answer on that, if they require it or not. As a practitioner myself, it would be remiss if you didn't have it, given that you are working with.
So it's
vulnerable
it's readily
populations.
available to
It
your
is,
profession in
yes,
Georgia?
yes.
Okay. Thank you. That's all the questions I have.
Okay, I see no other questions from the committee. We do have some additional speakers that want to speak to the bill. Oh, I'm sorry, didn't see you. Yes, ma'am.
Thank you, Mr. Chair, and I have just a few comments to address to Chairwoman Dempsey. First of all, let me thank you for your insight and to the questions that have been raised as to what's motivating this on the side of those receiving pay. I'd like to think that what is motivating this is the growing need and recognition of our patients and constituents who need this service. And so I want to commend you for your continuing to follow up with that, because especially with the speaker coming out with his mental health bill this week and everything going along with children with autism and developmental disabilities, this certainly does add an extra level of protection for for the people in our constituents. So I thank you very much for bringing this. And Mr. Chair, at the appointed time, whenever you get to it, I'd like to make a motion.
Thank you. And thank you for the work that you do.
We do have some other speakers who want to speak to the bill, and we have a list of those. We'll recognize them in order. Tom Bauer.
Thank you, Mr. Chairman, members of the community committee. I'm Tom Bauer with the Georgia Occupational Therapy Association. And we participated in all three meetings with the GORC, and it was a very healthy discussion. And let me start off by saying we absolutely agree that the applied behavioral analysts should be licensed. They do need to be regulated. They're working with lots of folks with vulnerabilities, particularly kids with autism. But we think the bill really does not go far enough, and there were some concerns, and I want to apologize for bringing these major concerns. I've talked to Representative Dempsey. I only saw the substitute last night and thought we were going to have a little bit more opportunity for offline discussion on ways to respond to the GORC recommendations. GORC recommended approval of House Bill 412, but they also recommended that there be work to address the accountability and supervision of the technicians. And we actually offered amendments in this regard, but haven't had an opportunity, haven't had any feedback on that. The major problem that we see is with the registered behavioral technicians. These are folks who have a high school degree and a 40-hour online course, which, as far as I know, has no patient contact. And then we're sending them into the homes to see these kids, treat them with autism. There's no requirements that the board even know who these technicians are. We had actually recommended they be registered with the board. And we appreciate the opportunity to talk earlier, I just before last session with Dr. Musing and some of his folks and Ms. Clifton. And I was really surprised to learn in talking to him then that some of the behavior analysts have as many as 10 technicians working with them at the same for them at the same time. And the supervision is really minimal when you compare it to some of the other professionals here in Georgia. For instance, this committee has seen a lot of legislation lately on physician assistants and advanced practice nurses. These are folks with master's degree and generally 27 hours, 27 months of training, yet the supervision of them is much more stringent than we have in this bill. So we would hope that we could take a look at that. There's particularly in the homes, we had offered also a suggestion that there be more in-home presence by the analysts. I know these folks work in clinics and places like that, and I'm less concerned about that than in working like 30 hours a week at home with these kids. So we had made the recommendations that that this board directly regulate the technicians. Let me stop and say this board has less authority, to my knowledge, than any other board in the Secretary of State's office. Yes, it does have national standards, Representative Williamson, but they're all located elsewhere. You'd have to go online to look at it. And this bill is almost like a certifying body after taking the word of this of the national certifying body. Most of our other boards do use these certifying bodies for the test, and I'm contracting to use those tests but this is not really the case here, where you just have much less supervision and much less board contact. We would hope that there would be more time to discuss this. I had mentioned to Representative Dempsey that I'd love to be able to take a week to look at it, so that we could get this more in line with the other Georgia boards and a little bit more on the supervision of technicians, which really are very much more lax supervision than we have for folks even like PAs and NPs. That's pretty much it in a nutshell. I will mention that Gork did mention that caveat, and I really don't think that this substitute, it barely reacts to that Gork recommendation to look at the accountability and supervision of the technicians. I think they did put the word in there in the exemption clause, saying that the technician was the responsibility of the behavioral analyst who's supervising them, but it's pretty loose, and it's not a whole lot of supervision and not a whole lot of final authority for the board as we have with the other boards. We also had recommended, which is I think I would hope a less minor change, the scope of practice of the analyst is pretty broad, and we had asked that it just have a clause at the end that it says this does not include the practice of occupational therapy like it does for psychology. Those are our main concerns. It sort of pains me. I have a lot of respect for Representative Dempsey, and I hope that we would take a little bit more time to look at this, and I'll be happy to answer any questions.
Thank you, Representative Walensky.
Thank you, Chair. I understand the concern about behavior technicians, but in terms of the applied behavior analysis and what we're doing here to get them to start to be regulated and could go forward over time, would you agree that's a good start?
Absolutely. As I said up front, we think that these folks ought to be licensed. We just think that the board ought to know who's working for them and have more parameters for what the work they do. It's all up to a body somewhere else in another city. We also made some suggestions, and I will admit, and Representative Dempsey talked about the other states. This bill is similar to a lot of other states. That doesn't mean, that's just not similar to the way we have done things here in Georgia. And but we just think it doesn't really go far enough to supervise the technicians who really are minimally educated and trained.
Thank you. No more questions, Chair.
Representative Bennett.
Thank you, Mr. Chair. Hello, Mr. Bauer. I have a particular question. How does occupational therapy still utilize technicians?
We have aides, yes, assistants, yes, and they have a associate's degree.
No, not an assistant, an aide or technician.
Not generally, no.
So they no longer utilize
No,
aides
not
or
much.
technicians in
It's really
practice?
not the same parallel as with the PTs, if that's where you're talking about with the aides.
Yes, I didn't know if,
No.
my question was purely informational.
Yeah.
Do the occupational therapists utilize aides in their current practice?
No,
Okay, thank you.
but so the closest thing would be these assistants, the OT assistants, and they have a associate's degree.
Thank you.
Okay, thank you, Mr. Bauer. That's all the questions we have.
Thank you.
Chair recognizes Ms. Pope to speak to the bill.
Mr. Chairman, members of the committee, my name is Jamila Pope. I'm the Government Affairs Director at Children's Healthcare of Atlanta, and the Marcus Autism Center is part of the Children's Healthcare of Atlanta family. And we are one of 5 NIH centers of excellence. We have some of the largest clinical volumes of treating kids with autism of anywhere in the country. We are here in support of this bill today. Chairman Dempsey has done a great job bringing it to you and going over the specifics. I won't cover those, but I would tell you that we employ Bcbas at Marcus Autism Center. They provide the applied behavioral analysis therapies to our children that are patients there. And we believe that this would help ensure that the professionals practicing in this state, not just inside the walls at Marcus Autism Center, but anywhere in this state, are properly credentialed and hopefully receiving the necessary continuing education credits. We also have a joint master's BCBA program with UGA. So students who are in that master's program are being trained either by telehealth or they are actually in the walls at Marcus Autism Center. So that's a little bit about why this is important to Children's and Marcus Autism Center, and I'm happy to take any questions.
Okay, we have a question from number 18. Who is that?
Me.
Chairman Mitchell.
Yeah.
Mhm.
You heard the concerns of the prior speaker, Mr. Bullard. How do you answer those?
So our folks have taken a look at this bill and they think that it is a good step forward and making sure that these BCBAs who are currently credentialed by a national board are licensed here in Georgia.
Thank you, Mr. Chair.
Thank you. Okay, I don't see any other questions. Thank you. Next we have, and I apologize, but I'm having trouble reading the last name. First name is Joanna. She said no. Okay, she waited. Next we have Tim Davis. Oh, that was on 4:30, I believe. Next we have Anna Bullard. Ms. Bullard.
Hi, thank you so much for hearing me today. I actually am a parent of a child with autism, which is the primary services delivered by a board certified behavior analyst. I started working on a bill back in 2008 with Representative Dempsey to get the coverage And so my daughter was diagnosed with autism here in Georgia, and there was nothing, no insurance coverage, no Medicaid coverage. And it's a really life-changing treatment. So we paid privately, which a lot of families can't do. So I will say this benefit changed her life. She's graduating this year. She was diagnosed nonverbal, severely autistic, and she's graduating and going to go to UGA, which is a huge testament to the service that board certified behavior analysts and RBTs deliver. And so I will say from the parent's perspective, right now, insurance covers it through the board certification, which is a national board certification. The RBTs are also registered in that same national certification. No insurance pays for services unless you're board certified. All the billing is done up under that board certified behavior analyst. Medicaid covers it. CMS doesn't require a license. There are 17 states that don't have it. I'm not opposed to a license. I just want to talk just a few minutes about some of the issues we've seen in other states. So in Georgia right now, there are now a little over 900 BCBAs practicing, which there's an estimate about 30,000 kids with autism. So about half of the kids in our state are accessing care. And that obviously some of these BCBAs could be to the point providing other services to children who don't have a diagnosis of autism. I know I live in Vidalia, Georgia. So the closest place for anyone in a rural area to get service is to drive over an hour. So, if you live in Atlanta, you still are on a wait list. So my concern is about access to care. And what we've seen in states like Arizona is they pass a licensure, and now a BCBA has to get licensed, and it's over 9 months before that license comes through. And, there's lots of reasons why, because it's, workforce issues and all that. Tennessee put a provision in place that you can get a provisional license because it was taking 6 months. A state like Texas, I would be okay with, because they basically created a license where you go online and do it, and within 48 hours, you have a license. So there's no issue with access to care. I feel like the insurance companies and Medicaid has done a really great job regulating the services that our kids are getting. I understand that you can maybe in the school system have people who are delivering what they might call ABA that aren't regulated, which again, I'm more talking about what's paid for through insurance and Medicaid. I feel like, that we've done such a great job at creating that. So I would just ask that you consider, when you are passing this bill, potentially putting a timeline in there or a provision in there to ensure that I don't get my kid diagnosed with autism and then I'm waiting for life-changing treatment they're 3 years old and they can't get services started till they're 4. I mean, right now they're already waiting on a wait list. I'm just concerned it's going to compound on that unless there's some sort of way that we can hold each other accountable to a timeline. So that's my only suggestion. I will also say the board certified behavior analyst supervises the RBT. And I just wrote down, just for everyone's knowledge, each RBT gets supervised for a minimum of 5% of the hours being delivered. So if you're getting 30 hours, you have to be supervised a minimum of 5% of that. This is straight from the certification board. Supervision must include 2 face-to-face synchronous contacts per month. So, there is a lot in place for the RBT, and no state that has a license includes RBTs. Florida has a registry, but it's just a registry. The turnover for RBTs, because it's entry level, is about 40%. So you could really be licensing a lot of people and creating a lot of issues if that's included. But I thank you for your, consideration in the access to care piece for us as parents.
Thank you, Ms. Bullard. We had one question. Chairman Carpenter.
Thank you, Chairman. It's actually more of a comment, and I concur with what you're saying. That was my concern the whole time, and that's why I made the comment about, is a doctor going to send them his patient to somebody that's not good at what they do or not credentialed to do that. And I think you just added another layer of protection, as they better have their credentials or they're not going to get paid.
Right.
So we hear a lot of licensing bills, and I'm not here to railroad it, but I do have concern that in a time when we need more of something, we're doing something to actually constrain that and making a government funnel, if you will, to get people out of. So that would be my concern. Obviously, I'm just one person, so I don't make that call, but and I know a lot of people worked on this, but that is my concern as a committee member, that we're actually going to funnel something at a time when we don't need to funnel it. So thank you.
And parents do have a way to complain to the board. And as he said, maybe that, could be fixed. Again, I'm not here to get in anyone's way. I just want to make sure that's being considered. Thank you.
Thank you. Next, we have Michelle Nelson. You're not going to speak. Okay. We do have one lady by Zoom, Anita Brown, will testify or will present to us virtually.
Are you ready for me, sir?
I'm sorry.
She hears you. She is. You can let her know she can speak.
Ms. Brown, you can address us, please.
Thank you. I'm standing by on Zoom.
Okay.
My name is Dr. Anita Brown. I'm the Director of Professional Affairs for the Georgia Psychological Association, and we are here to testify about this bill. We also participated in the GORC hearings and in meetings with the association. We too support the licensure of applied behavior analysts in Georgia. Our concerns with the current bill are fivefold, and I will be relatively brief. The first has to do with the scope of practice, lacking specificity, particularly in line 45 of the bill. The use of the word interventions is not clearly defined as proposed and should be linked to the remainder of the definition. This change would be consistent with similar laws in the states of Alabama, Kentucky, and Texas. In addition to that, we see that the scope of practice lacks certain exclusions to the extent that applied behavior analysis, which spawns from psychology in its study and use of behavioral techniques, should include a further definition of the practice of psychology, psychological testing, diagnosis of mental or physical disorder, psychotherapy, cognitive therapy, cognitive behavioral therapy, psychoanalysis, and counseling. So adding a couple of terms there that are specifically in the purview of the broader field of psychology as a practice and as a discipline. We too feel that the work of the behavioral technician would be inadequately regulated. These are the people, as described, who are truly on the front lines of this work. And we feel very strongly that more oversight than is gathered in this bill, in spite of the sense that it would be limiting, would actually ensure that the work that is being done by these large numbers of technicians would be appropriate, accurate, and regulated. A family member's use of applied behavior analysis at home is unclearly excluded. It appears that this is allowed only when done under the extended authority and direction of a licensed individual, which I'm not sure how many parents would feel that they need to have that oversight of the care of the child in their own home. And finally, the specification for a licensed psychologist, the extended specification in lines 161 to 164 is unnecessary. Psychologists, as licensed individuals in Georgia, operate under a code of ethics, and this ethics precludes them from doing any work for which they are not duly trained. And so to add this stipulation for psychologists, which is not included under any other occupation, specifically physicians, is a bit of overkill. if you will, we do not practice outside the scope of what we've been trained to do. And so to state in this bill that psychologists who are doing licensed behavior analysis need to demonstrate that they have that appropriate training is superfluous. As I stated, we do support licensure and regulation. We support it when it's controlled within the state and not by extra state, external regulating bodies, except for the purposes of the testing and curriculum development, perhaps. Thank you for your time.
Thank you, Ms. Brown. Any question? We do have some questions. Okay. We do have number 27. Is that Representative?
Me, no question, but I just wanted to make a motion to pass at the proper time.
Okay. Before we do that, we do have another comment from Representative Bennett. Representative?
No, Mr. Chair, I just wanted to acknowledge that I would like to make a motion to pass at the appropriate time.
Yes, ma'am. I remember your comment about that earlier. I think it might be appropriate, Chairman Dempsey, would you like to make any closing comments here since we've had some folks speaking against your bill?
Sure, I will. I think that we've all heard and can agree that without a doubt that these professionals need to be licensed. I want to direct you in the bill to the language specifically, just to make sure that you read it about technicians. So if you go to line 24, that's the definition of the technician, paraprofessional who practices under the extended authority, close and ongoing supervision, responsibility of a licensed behavioral analyst or licensed assistant behavioral analyst and delivers services as assigned by such licensee, but does not design, assessment, or intervention plans or procedures. Also then, back on about page 8, it begins at line 165, but at 167, such individuals shall not represent themselves as professional behavioral analysts and shall use titles that indicate their non-professional status, such as ABA technician, behavior technician, or tutor. It very distinctly says what those differences are. Most of the individuals I know today, we've been told they were in high school. Many are not. Many are also exploring career opportunities. They're often in a temporary exploratory position of looking at this and might continue and want to become that analyst, which is what we have a great need for in our state as well. They're exploring their future. If we add another level of licensing, it would probably triple that cost of doing it. And what we just heard is that we don't need to deter people from going into this field, but also to add that burden to the Secretary of State to deal with the licenses. The projected number of licensees are this, that if it were in 22 this year, there would be about 1,021 licenses. In 24, 1,244. That is pretty much the practical observation of what we're looking at expanding to, but not overwhelming or or flooding the market necessarily. So if there are any other questions, I'll be glad to take them. If not, thank you.
Thank you, Madam Chair. I don't see any other questions. I'd like to recognize Representative Bennett for a motion.
I move to pass.
We have a motion for due pass. Is there, and a second? Any more discussion from the committee? Hearing none, if you're in favor of this motion to pass this out of this committee, say yes. If you oppose it, say no. And there is no opposition and the bill passes. I think that's the extent of the business we have today, and so this committee stands adjourned.